Chapter 6, Childhood Illness, Identification and Management. So let's look at early signs of illness. So teachers should be familiar with the characteristic signs of common communicable illnesses in children. And recognizing those early signs provides an effective method for limiting the spread of communicable illnesses to other children and to the adults in the environment. So some general symptoms that we see before we see the specific symptoms for each illness is dizziness, and this can happen after vigorous play, but also be an early general symptom. Fainting, this is a momentary loss of consciousness that is caused by the blood supply to the brain or the lack of blood supply to the brain. A fever, and this could indicate infection, and on page 151 gives you some specific information about that. And then the different types of thermometers you can use, you can see some information about that on page 152. Headaches, so though headaches are not common in childhood, they can be an early symptom of illness, and you can see more about this on page 153. And then sore throats. This can be infection or sinus drainage, and that can be caused by allergies or even mouth breathing. Stomach aches, this could be hunger, a full bladder, or intestinal cramping, but there are some examples of when stomach aches can be serious on page 155. Vomiting is another general symptom, and some causes are on page 159. And then diarrhea is frequent runny or soft bowel movements, and you can find more information about that on page 147. Frequent or long-term diarrhea can cause dehydration, and this can be fatal in infants. And also pain in the lower right should be checked by a doctor because of risk for appendicitis. So airborne transmitted illnesses. And so here are some common illnesses that are airborne: chickenpox, colds, fifth disease, measles, meningitis. And if you look at table 6-1, it'll tell you symptoms, transmission, contagiousness, incubation periods, and then how to treat or deal with these illnesses. Some more airborne transmitted: mumps, strep throat, whooping cough. Some bloodborne illnesses, these are transmitted through the blood. You can find, again, information on table 6-1 in your chapter. And HIV, acquired immune deficiency or immune deficiency disorder syndrome, which results in AIDS, and hepatitis B are bloodborne transmitted illnesses. And then contact transmitted through indirect or direct methods. Again, table 16-1, pink eye, impetigo, head lice, herpes simplex or cold sores. Other common illnesses that are from a parasite would be ringworm, Rocky Mountain spotted fever, scabies, tetanus, and I think the picture on the right is a scabies parasite. And then fecal-oral transmitted. These would be shingles, E. coli, hepatitis A, pinworms, Campylobacter that we talked about in the food service chapter, Giardia, and I think the picture is a Giardia parasite. So let's look at some other common illnesses. Earaches. So earaches are common, especially in boys younger than 3 or 4. More than half of children have one earache in the first year. It's more common in bottle-fed children and those that are exposed to secondhand smoke, but the incidence gradually decreases with age. Earaches are often associated with congestion from allergies, colds, infants that are fed semi-upright, and foreign objects placed in the ears. So ear infections, and on page 149 it gives you some more information about ear infections. Colds, children get as many as 7 to 8 per year. This decreases as the respiratory system matures and the immune system develops. It's caused by viruses that antibiotics don't affect, so we can't get any immunizations for colds. They're highly contagious in the first day or two. We want to seek medical assistance if a child does not improve after 4 or 5 days. And yellow mucus means it's viral, caused by a virus, and green mucus means bacterial infection. Lyme disease. This is a tick-borne infection that's becoming increasingly more common. So prevention is the best method of defense, and so we want to wear protective clothing when we're hiking or out in areas where you may find ticks. Use insecticide repellents. Take a bath and inspect your skin after playing outside, and remove ticks quickly and carefully. Sudden infant death syndrome, or SIDS. Approximately 2,200 infants die each year from SIDS. It's a leading cause of death among infants between 1 and 12 months of age. Male infants that are a higher risk, 61% for developing SIDS. A specific cause has not been identified. That's why it's called a syndrome. But certain factors are known to increase the risk of SIDS. Sleeping position. An infant should always be placed on his or her back. And in fact, when we started doing that, the incidence rates for SIDS went way down. A lack of maternal prenatal care, smoking, drinking alcohol, or using drugs during pregnancy, exposure to secondhand smoke, respiratory infections, premature birth before 37 weeks, being born to a teenage mother, and being in a bed with blankets, bumper pads, and a soft mattress. These show relationships between these factors and then the incidence of AIDS, but it doesn't necessarily cause, not AIDS, but SIDS, SIDS, sudden infant death syndrome. So these have a relationship, these factors have a relationship, but may not necessarily be the cause. So the CDC's Back to Sleep campaign teaches families to care providers to always put infants to sleep on their back and in their own bed. And keep in mind that developmental transitions, that transition from the reflexes found in a newborn to actually those reflexes becoming learned behaviors, those are times in an infant's life when they're most susceptible to succumbing to sudden infant death syndrome, because an infant that has not learned how to deal with issues like blankets over their face, reflexes can help with that, like the Moro reflex. But when that disappears at about 3 months, if the infant hasn't learned how to do that without the reflex, then they're at high risk for sudden infant death syndrome. Additional measures: mothers are urged to get prenatal care and avoid harmful substances during pregnancy, like drugs, alcohol, or smoking. Breastfeeding offers infants some protection, and then remove soft items from the bed and avoid dressing infants too warmly.